Good morning, everyone. I'm excited to welcome you all today. Thank you for being here. Today, we'll be exploring the important field of medical surgical nursing. My name is Perk Kishan, and I hold a PBBSc in nursing. On this first slide, you see the title of our presentation, Medical Surgical Nursing, and my name. Over the course of this session, we'll cover key concepts, responsibilities, and the role of nurses in this vital area of healthcare. Let's get started. Let's take a closer look at the principles of emergency management. These principles form the foundation for how we respond to and handle emergencies effectively. First, it's essential to understand that emergency management is a continuous cycle involving preparedness, response, recovery, and mitigation. Each phase is interconnected and vital for minimizing the impact of disasters. One key point is the importance of a coordinated approach. During an emergency, different agencies and organizations need to work together seamlessly. This coordination ensures resources are used efficiently and that everyone is working toward the same goal, protecting lives and property. Another critical principle is flexibility. No two emergencies are exactly the same, so our plans and responses must be adaptable. Being flexible allows us to adjust quickly to changing circumstances on the ground. Additionally, community involvement is a core principle. Engaging the community before, during, and after an emergency helps build resilience. When people are informed and prepared, they can take appropriate actions and support recovery efforts. Finally, a focus on continuous improvement is essential. After every incident, we should evaluate what worked well and what could be improved. This ongoing learning process strengthens our preparedness for future emergencies. All these principles, coordination, flexibility, community involvement, and continuous improvement, are central to an effective emergency management strategy. They help us ensure that we are not just reacting to disasters, but proactively reducing their impact and enhancing resilience across our communities. Let's take a closer look at the basic principles in emergency nursing. First, nursing plans should be integrated and coordinated. This means that all aspects of patient care, resource management, and team efforts need to work seamlessly together to ensure the best outcomes during emergencies. When everything is well coordinated, it helps us respond more effectively and avoid confusion. Next, updating physical and psychological preparedness is crucial. Emergencies can be unpredictable, so staying physically fit and mentally prepared allows us to handle stressful situations calmly and efficiently. Regular training and mental readiness are just as important as our physical skills. Moving on, we're responsible for organizing, teaching, and supervision. As emergency nurses, we don't just respond. We also need to organize our teams, educate others on protocols, and supervise to ensure everything runs smoothly. Leadership and clear communication are key here. Another vital principle is stimulating community participation. Engaging the community before and during emergencies helps build resilience. When people are involved and informed, they can assist in response efforts and support each other more effectively. Finally, exercising competence is fundamental. We must continuously hone our skills through practice and education. Confidence and proficiency in our abilities make a significant difference in emergency situations, ensuring we provide the best care possible. All these principles are interconnected and contribute to a comprehensive, effective emergency nursing practice. They help us stay prepared, organized, and responsive, ultimately saving lives and reducing suffering. Today, I'll be discussing the basic principles of nursing care for disaster victims. First, we have the adaptation of skills to the situation. This means that as nurses, we need to be flexible and ready to modify our usual techniques to meet the unique demands of each disaster scenario. It's about applying our knowledge effectively in challenging environments. Next, caring for disaster victims is a fundamental principle. This involves providing compassionate, patient-centered care despite the chaos around us. Our goal is to ensure comfort, safety, and dignity for those affected. Continuous awareness of the patient's condition is also crucial. We must constantly monitor and reassess their status, as their needs can change rapidly in a disaster setting. Staying alert helps us respond promptly and appropriately. Training auxiliary personnel is another key point. We need to teach and guide our team members so that everyone is prepared to deliver essential care. This teamwork and shared knowledge are vital for efficient disaster response. Finally, the selection of essential care is about prioritizing interventions. In emergencies, resources are limited, so we focus on the most critical needs first, stabilizing vital signs, preventing infection, and managing pain. All these principles connect to the overall goal of providing effective, compassionate, and adaptable nursing care during disasters. Our preparedness and ability to apply these principles can make a real difference in saving lives and alleviating suffering. Let's talk about emergency nursing principles, starting with the primary survey. This is the initial assessment we perform to identify and address life-threatening issues quickly. It follows the ABCD approach: airway and cervical spine, breathing, circulation, disability, and exposure. First, ensuring the airway is clear is crucial, and protecting the cervical spine if trauma is suspected. Next, we assess breathing to see if the patient is ventilating properly. Then, we check circulation, looking at pulse, bleeding, and perfusion. After that, we evaluate neurological disability, which helps us understand the patient's level of consciousness. Lastly, we expose the patient enough to check for other injuries, but avoid unnecessary heat loss. Triage guidelines come into play here, helping us prioritize patients based on the severity of their conditions so we can act swiftly and efficiently. Basic first aid skills are also fundamental. Things like controlling bleeding, immobilizing fractures, and supporting vital functions until advanced help arrives. Finally, understanding cardiac arrest and CPR is vital. Recognizing cardiac arrest early and performing CPR can be life-saving, maintaining blood flow until advanced resuscitation is possible. All these principles tie together to form a comprehensive approach in emergency nursing, ensuring we deliver prompt, effective care when it's needed most. This slide doesn't contain enough information. That's why we're moving to the next slide. The fundamental principles of emergency management are built on 4 key phases: mitigation, preparedness, response, and recovery. Today, I want to focus on the mitigation phase. During this phase, we conduct an annual hazard mitigation risk assessment. This assessment helps us identify which hazards are the most critical and require our immediate attention in the upcoming year. By focusing our efforts on these specific areas, we can effectively reduce the risks faced by our university community, our students, faculty, and staff. This proactive approach is essential because it allows us to prevent or lessen the impact of potential emergencies before they happen, aligning perfectly with our overall goal of creating a safer campus environment. Building and maintaining our incident command and crisis action teams is truly at the heart of our preparedness activities. What that means is we focus heavily on training these key staff members in emergency management procedures, so they're ready to act quickly and effectively when needed. We also develop detailed emergency response plans and continuity of operations plans to ensure the university can keep running or quickly resume essential functions during a crisis. In addition, we conduct both tabletop exercises and full-scale drills. These simulations help us test our plans, identify gaps, and improve our coordination. Participating in programs like Storm Ready Further enhances our readiness, especially for severe weather events. And of course, we continuously maintain our BU Alert emergency notification system, which is crucial for timely communication during any emergency. All of these efforts work together to strengthen our overall ability to respond effectively and protect everyone on campus. This comprehensive approach is vital in ensuring we're prepared for whatever challenges may arise. Our initial response involves the dedicated men and women from several key departments. These include facilities management and planning, environmental health and safety, and public safety. These teams work together seamlessly to ensure a swift and effective initial response. It's important to highlight that Boston University has built strong relationships with public emergency response organizations in both Boston and Brookline. This means that if and when they're needed, we can count on their support to handle emergencies efficiently. This collaborative approach is a vital part of our overall safety and preparedness strategy. It ensures that from the moment an incident occurs, we're not alone. We have a well-coordinated team ready to respond. This teamwork and established partnerships are essential to maintaining a safe environment for everyone on campus. The objective of the recovery phase is to get our campus back to normal as quickly as possible, essentially restoring things to the way they were before the emergency occurred. This is a critical part of our overall emergency management plan. Throughout history, whether we're dealing with snowstorms, floods, or fires, our incident command and response teams have consistently met this goal. They work tirelessly to ensure that disruptions are minimized and that the campus can return to its regular operations swiftly. We also collaborate closely with the Mayor's Office of Emergency Management, as well as the Massachusetts and federal emergency management agencies. This partnership gives us confidence that if we face a large-scale emergency or disaster, the necessary resources will be mobilized and arrive promptly. Ultimately, the recovery phase underscores our commitment to resilience and quick restoration, which is central to our overall emergency preparedness and response strategy. It highlights that we're not alone in these efforts. There's a network of support ready to assist us when needed. Thank you so much for your time and attention today. I really appreciate your interest and engagement throughout this presentation. Remember, the key points we've discussed highlight the importance of collaboration, innovation, and continuous improvement in achieving our goals. I hope you found the insights useful and inspiring as we move forward together. If you have any questions or want to discuss further, please feel free to reach out. Once again, thank you very much for being here.